Steve Goodman, and I am the director of Michigan's multi-tiered system support Technical Assistance Center. About the work, our experiences with implementation, science and education, we have been implementing the concepts and strategies into our multi-tiered system of support framework for about the past 12 years. And when I say implementing those concepts, we are embedding it into our training and technical assistance that we offer. We also focus on creating systems to effectively support implementation with fidelity that's sustainable and scalable. So that is focused at not only the school, but at the district, at our intermediate unit, and then also up to our state level, as well as within our project itself. We've been looking at it as a way to almost like engineering or improving or adapting the organization host environment to really enhance the individual's performance to effectively implement specific evidence-based practice or research-informed practices. And when I say engineering, is how do we set up conditions that really make it easier for the implementers to implement these practices well? And that engineering really looks at the conditions for the educators to say, you know, I need to know what to do, how to do it, and how do I know if I'm doing it correctly, along with all the materials and resources that help me to do it well. So we are implementing a multi-tiered system support. We're supporting that as a framework. So within that framework, what we are focusing on is to say it is a series of structures, a series of procedures that help implement a tiered delivery system. And when I say tiered delivery system, we differentiate evidence-based practices based on student need. So the more intensive the need, the more intensive the implementation of those supports should be. And what we do is we have our colleagues and Anna Harms, who is our administrator for evaluation research, really has developed a nice system that can house data support. And what we look at that is basically as for evaluation as opposed to accountability, we use it for decision making. And within that decision making, we need to first see, are we making an impact on student outcomes? So we collect data around impact, which would be outcomes as well as perception of how the program is working. We also make sure that if we're going to get the outcomes, we need to look at fidelity to see if people are implementing these effective practices well. And then to have fidelity in place, we need to make sure that there's the capacity to best support implementers. So our data system provides access to that in real time, or at least, as a more frequent basis that we can use for improving our program overall. Facilitated administration, what's interesting for us with that, there are barriers that interfere for any type of implementation efforts. And those barriers, example would be funding, for example, guidance around funding. And so through facilitated administration, we are looking at how do we provide guidance for people to say, this is how you can use existing funds to actually achieve your implementation efforts. It's also things like consistent communication across, because our receivers may not understand what we're trying to do and other programs would do. So we have a leadership at the Michigan Department of Education that focuses on MTSS for that work. intervention is interesting because what we look at is that practices can take place in a specific setting, but the systems cut across multiple settings. So if you are in a school, you can go only so far without the district support for it. If you're in a district, you can only go so far without an intermediate unit or the state influencing. And then there's also other examples of outside, the educational system. I'll give you an example. So attendance is another district we're working at. Attendance is a big issue. And this was a urban setting. And if you think about what's factors for attendance, getting students to attend school, absenteeism could be caused by the children not having access to transportation, effective transportation. It could be because they don't feel safe in the neighborhoods going to school. It could be because there is mental health issues around anxiety and not attending school because too anxious that day. Or it could be other things like asthma that is affecting, so there's a physical health. Or it could be just childcare. They need to take care of the siblings. So in that example, there's things that cut across just the school. There needs to be some things that the district can help the school in supporting students. And that may be around transportation, or it may be, identifying what that specific student needs, or it could be the community efforts. So if the students don't feel safe in that neighborhood, how do you interact with public safety for it? If the student is feeling anxious, how do you interact with, mental health or counseling services that could be outside? So as a systems intervention, we are saying we are part of a larger system, and how does it cut across to make sure that we are effective in meeting needs of our students?